Hello everyone, welcome back to my channel Physio Vitals. I am Dr. Ankita Savan and today we are diving into the topic of sciatica, a common yet often misunderstood condition that affects millions worldwide. Sciatica refers to pain that radiates along the path of the sciatic nerve, the longest nerve in our body. It is the longest nerve in our body. So it's a very painful breath holding condition that doesn't allow an individual to rest or relax. So, this nerve travels from the lower back through the hips and the buttocks and down each leg. Sciatica is not a condition in itself, but rather a symptom of an underlying problem. So, let's break down its cause, how it affects the body, and the ways to manage it. So, sciatica is a common condition affecting the sciatic nerve, causing pain, numbness, and tingling that radiates down the leg. This presentation aims to delve into the anatomy, causes, and treatment options for the sciatica. Moving further to the anatomy. So, the sciatic nerve is derived from the spinal nerve root L4 to S3. So, these nerve roots exit the spinal cord and combine to form the sciatic nerve, which runs through the gluteal region and down the posterior aspect of the leg. It then divides into two branches above the knee, the tibial nerve and the common peroneal nerve. These branches control the muscles and sensation in the legs and feet. Understanding the anatomy of this nerve helps us to understand why symptoms like pain, numbness, and weakness can be so widespread. So, the sciatic nerve originates from the lumbar and sacral nerve root from the lower spine, courses travels through the buttock, down the back of the leg, dividing into tibial and peroneal nerve, and it provides motor and sensory innervation to the leg and the foot, controlling movement and sensations. Now, moving further to its nerve course and physiology. So, the sciatic nerve begins in the lumbar spine, exiting between the vertebrae in the lower back. It passes under the piriformis muscle, very important. It passes under the piriformis muscle, travels through the greater sciatic foramen, and then extends down the posterior thigh. At the knee, it splits into two branches which innervates different parts of the lower leg and the foot. Any irritation, inflammation, or compression along this pathway can lead to sciatica symptoms. So, the lumbar and sacral nerve root. The sciatic nerve originates from nerve roots in the lumbar and sacral region of the spine. Sciatic nerve. The nerve travels through the pelvis and down to the back of the leg, providing innervation to muscles and skin. The tibial and peroneal nerve. The sciatic nerve divides into the tibial and peroneal nerve, which continue to innervate the lower leg and foot. Pathophysiology. Sciatica typically arises where there's compression or irritation of the sciatic nerve. This can occur due to several reasons. So, disc herniation. One is disc herniation, which is the bulging or the herniation of the disc in the lumbar region can press against the sciatic nerve. So, whenever a person is suffering from the disc herniation, which means the bulging of the disc or the disc slip, the lumbar spine can press against the sciatic nerve. In this case, the sciatic nerve gets pressed. Next is spinal stenosis, which is the narrowing of the spinal canal may compress the nerve roots. Piriformis syndrome. When the piriformis muscle irritates or compresses the sciatic nerve, it can lead to sciatic-like pain. Then spondylolisthesis. A vertebra slips forward, potentially pinching the sciatic nerve roots. All these conditions lead to inflammation, which irritates the sciatic nerve and causes a sharp shooting pain characteristic of sciatica. Compression we just saw, the sciatica often arises from the compression or irritation of the sciatic nerve root. Herniated disc. A herniated disc can bulge and press on the nerve root, causing pain, numbness, and weakness. Spinal stenosis, narrowing of the spinal canal, can also compress the nerve root, leading to sciatica symptoms. Okay, very important, clinical assessment of the sciatica. So when assessing the sciatica, we perform a thorough physical examination and review medical history. So straight leg raises, SLR test. Lifting the leg while the patient is lying flat may reproduce the pain. Then we can do slump test. This test involves the patient sitting and slumping forward while the clinician extends one leg at a time to elicit the symptoms. Neurological examination. We check for muscle weakness, reflex changes, and sensory deficits, particularly in areas which are innervated by the sciatic nerve. Then we also go for imaging techniques, imaging diagnostic techniques if necessary, like MRIs or CT scans can help visualize any structural issues like herniated disc or spinal stenosis, which will aid in diagnosing. So, thorough history, patient's description of symptoms, onset, and aggravating factors. In physical examinations, we need to do motor function assessments, sensation, reflex, range of motions, and some special tests, which are just said, SLR, slump test, and all. And finally, imaging diagnostic techniques for to diagnose to see the whether there is any structural abnormalities or not. Now, pharmacological treatment approach. So the primary goal in pharmacological treatment are pain relief and reduction of the inflammation. So here we'll speak about NSAIDs. So ibuprofen and naproxen reduces the inflammation and the pain. So pain relief over the counter or prescription pain relievers can help reduce pain and inflammation. Then we go to muscle relaxants. Cyclobenzaprine helps relieve muscle spasm that may contribute to pain. So muscle relaxants basically relieves the muscle spasm which may contribute to pain. So once the muscles are relaxed, pain will also alleviate. Muscle relaxants can help relieve muscle spasm and contribute to that may contribute to sciatic pain. Then corticosteroids for severe inflammation. Corticosteroids may be injected near the nerve root to reduce the pain. So these are the epidural space to reduce the inflammation and the pain. Gabapentinoids, gabapentin or pregabalin. So these drugs may be prescribed for neuropathic pain in more chronic cases. Always remember to consult a healthcare provider before starting or modifying any medication regimen. Now, very important point of this lecture is role of physiotherapy, how we need to rehabilitate anyone who is suffering from sciatica. Once a patient walks into your clinic or your setup, if you do the proper examination, proper assessment and listen to the patient and see the patient as a whole, then you can come to a conclusion of the diagnosis. So once you are thorough with your assessment part and the diagnosis is confirmed, then rehabilitation makes a very easy path. So, physiotherapy plays a crucial role in managing sciatica, addressing both pain and functional recovery. So, first we'll focus on the stretching exercises. The hamstring and piriformis stretches can help alleviate tension in the sciatic nerve pathways. So, stretching exercise may improve the flexibility and reduce the muscle tension. Next, we'll move on after stretching to the strengthening exercises. So, core stability exercises strengthen the muscles surrounding the spine, providing better support. Strengthening exercise helps improve the muscle strength and stability around the spine. Then we can also do the McKenzie exercises. So, these specific exercises help relieve pressure on the sciatic nerve caused by herniated discs. McKenzie exercises are very important and very beneficial for sciatic-like cases. Then we can approach the manual therapy techniques. So techniques like mobilization and soft tissue massages can reduce the muscle tension around the affected areas. Nerve gliding exercises. So designed to mobilize the sciatic nerve. So these exercises, nerve gliding exercises are specially designed to mobilize the sciatic nerves. So these exercises help reduce the nerve irritation. Consistency with physiotherapy exercises and a gradual approach are essential for long-term relief. Also very important, postural correction. Due to this postural, maintaining a proper posture can help you prevent any sort of injuries or problems. So if you maintain your posture correctly throughout the day, throughout your life, there will be no structural abnormalities in your life at all. So proper posture and ergonomics can help reduce pressure on the sciatic nerve. So thank you for watching. Sciatica can be a painful and frustrating condition, but with proper care and management, most people find relief and regain their quality of life. Don't forget to like, subscribe, and hit the bell icon if you want more contents on managing musculoskeletal conditions. If you or someone you know is struggling with sciatica, don't hesitate to seek professional help from a physiotherapist. Stay healthy, stay active, and see you next time. Thank you. God bless you all. Keep learning.